Hi everyone, today we're going to review infection control and procedures related to COVID-19. Infection prevention and control is crucial in fighting COVID-19. The Centers for Disease Control and Prevention, or the CDC, has provided infection prevention and control recommendations for healthcare workers. These recommendations can be applied to all healthcare workers, not those necessarily just at the bedside, but those who are working in home health as well. It's important to note that as time goes on and more information is understood regarding the virus and the current state of our country in terms of this virus and infection rates, these protocols may have to be adjusted. The recommendations right now are based off of the information that we currently have available. So it's important to stay up to date in case any of these recommendations change in time. According to the CDC, there needs to be a plan or process that identifies and manages those individuals who either are known to have COVID-19 or who we suspect to have COVID-19. So what does this mean exactly? It means testing these patients as early as possible. In terms of the hospital, we're going to see this, it should be starting right in the ER, just to limit our infection and transmission rates. And this testing is regardless of vaccination status. It also includes isolating those who we think have the virus. If it is possible, we need to place these patients in their own room and have signs outside the door that suggest the type of precaution that we need to use before entering the room. And this ensures the safety of our staff. The CDC also suggests that personal protective equipment, or PPE, needs to be worn by all healthcare members. Transmission of COVID-19 is thought to be of direct contact or respiratory droplets. Therefore, precautions for routine care of patients with COVID-19 require the use of droplet precautions, and then care for patients requiring aerosol-generated medical procedures need airborne precautions. The airborne would be those patients who are either receiving nebulizer treatments or if we have to intubate someone with COVID-19, for example. However, according to Islam et al. In 2020, due to the national shortage of healthcare providers, it's suggested that N95 or equivalent respirators for healthcare providers be used whenever possible to decrease the risk of infection. N95s or equivalent should be worn by all healthcare workers when there are multiple risk factors for transmission, and eye protection should be worn for all patient encounters. Because it is so important to wear PPE for infection control, I want to go over the correct order for donning and doffing our PPE, meaning taking on and putting off our PPE. So the first thing that we're going to do when we're putting on our PPE is to perform hand hygiene. Then we are going to put on our gown. Then we're going to put on our mask, whether that be our surgical mask for our droplet precaution or our N95 for our airborne. Then we're going to put on our eye protection. We have the goggles or the shield now, and then we're going to put on our gloves. We're going to enter the room, perform our patient care, and when we're exiting and taking off our PPE, we're going to remove our gloves first, then our gown. Then, if possible, we're going to perform hand hygiene in between these steps. We're going to remove our eye protection, and then our mask is the last. And once that is done, we're going to perform hand hygiene again. So if we have it available, it's best to wash our hands before we do anything around our face to take care of ourselves. It's so important to be putting on and taking off our PPE properly to protect ourselves as well as other patients that we're taking care of. Other infection prevention practices include promoting social distancing. This is not only when we're with our patients, not being face-to-face, like right up to each other when we don't have to be, taking those steps back to have any discussion that we need to have with them. But it also includes social distancing at our nurse's station, maybe not sitting directly next to someone to chart, maybe a computer over, and definitely taking lunches at separate times because our mask will be down for that. Other things that we should be doing is clustering our care with those who have COVID-19, our patients. bringing in all of our supplies at once, bringing in their water, their meds all at one time, maybe calling them in if you have the computer that can dial into the room to see if they need anything before you enter, so that you have all of your things together before entering their room, and in order to limit our exposure to COVID-19. Other things that we can do is limit in-person visitation. While that's difficult for our patients, we can encourage the use of our phones and, well, more so their phones, but the use of technology in this case, just to limit exposure for the public as well as our patients and staff. Other things that we can do is definitely perform hand hygiene very frequently throughout, wiping down our computers, keeping as much as we can clean, and our area clean. It's super important. Not wiping our face or touching our, rubbing our eyes, touching our face, trying to limit that to really keep ourselves safe, which is super important. These are all important steps in protecting not only ourselves, but others from the virus. Preventing the cause or spread of infections is critical in providing safe and quality care, and it begins with you. Thank you.